Hello, I'm Dan, and this is Dan Explains. Almost 2 years ago, I did a video on a drug called AOH1996, which researchers said could stop all solid tumors. Studies and clinical trials were pending. Well, it's been 2 years. Do we have any results? Yes, we do. Let me explain. Before I go into the updates on AOH 1996, let me give a little refresher on what it is and what it does for those who are just hearing about it now. AOH 1996 is a drug that targets an enzyme known as pCNA, or proliferating cell nuclear antigen. pCNA is an extremely important enzyme used in the process of cell division. Cancer, by its very nature, spreads through uncontrolled cell division. pCNA has always been kind of a dream target for cancer researchers, because it could stop that cell division in its tracks if they could target it. The issue is targeting pCNA exclusively in just cancer cells, while leaving the healthy cells alone. This was once thought impossible, but Linda Malkus, a researcher at City of Hope Cancer Center, was determined to find a drug that attacked only the mutated form of pCNA found in cancer. She looked through many drug candidates and eventually found AOH 1996, which appears to only target the form of pCNA that is found in all solid tumors. And that's the exciting part, because it may mean that AOH 1996 is effective against virtually all solid tumor-forming cancers. If you want to know more about how the drug works, you can watch my first video I did on it. Link in the description. So, where in the development process is AOH 1996 now? Well, several studies have been conducted, and many are underway to determine which cancers it's effective against. So far, everything is looking very positive. Every study released has shown anti-tumor activity against every cancer type tested. The only study that I could find that found cancer cells gaining resistance to AOH 1996 used special genetically engineered cells, which were engineered to have a special form of pCNA that was unique to their study. Although it does show that it's technically possible for a cancer to be resistant to AOH 1996, no cancer has been shown to have such a mutation in real tumor cells. It's even been found to be effective against non-solid tumor leukemia cells. But I mentioned in my last video on AOH 1996, the drug was in a phase 1 clinical trial. So, how effective is it in humans? And the bigger question is, how toxic is it, and can humans tolerate its effects? Well, just after the last video I did on the subject, the results of a preliminary study were released that found AOH 1996 was effective at reducing the size of pancreatic tumors by nearly 50% in a 2-month period in several patients. In fact, recently, a former US Senator, Ben Sasse, who has pancreatic cancer, has apparently been taking AOH 1996. Although it's not clear if he was part of the clinical trial, he said it's a miracle drug. These are just the early results, and the phase 1 clinical trial is still ongoing. Phase 1 clinical trials are primarily to study the toxicity of the drug and find its tolerance and dosage levels. So far, it appears that AOH 1996 is not toxic and is very well tolerated, even in large doses. However, the current clinical trial is only studying AOH 1996's effectiveness against solid tumors. There is an additional study looking at the effectiveness against leukemia. That study was suspended earlier this year. The exact reason for the suspension isn't clear, but if you do have a solid tumor cancer diagnosis, according to the US government's clinical trials website, the solid tumor study is still enrolling new patients. There's currently no word on when the phase 2 clinical trial will begin. So far, that's what I've got on AOH 1996. Thankfully, it's a lot more than I had on it a year ago. And even better, that its promise as a cure for cancer seems to be holding up against scrutiny. Thank you for watching. If you like this video and other topics ranging from theology to science, please press the like button, subscribe to my channel, and ring the bell to get notified when I post new videos. Also, please support me on Patreon to get extra content and special perks. Link in the description. The more people support me, the more time I can dedicate to making videos like this one. So, until next time, have a great week.